So you can start, huh? Bismillahirrahmanirrahim. Now it is the month of Ramadan, huh? We are most of us are all Muslim, so we are fasting, of course. So we should always pray to Allah for all, for the country, for universal peace, and for all my parents, siblings, so that we can stay fine. Anyway, today. Oh, acha. So today I think I take one class about how many months before? 4 months. The 5th year now. Yeah. So now today as this is combined class for the 4th year and 5th year, and also you are going combinedly in our ward hospital, right? Yesterday those are in the Gynae, that is in the ward. Stand up, ward. So okay, thank you. Which thing I discussed yesterday? Ectopic pregnancy. You saw the patient, you saw the procedure, and you saw the what I did. Can you say anyone what I did yesterday? Just anyone. Faster. Who is faster? Yes. Stand up. You mean Dakshana? You are foreigner or Bangladeshi? Foreigner. So you can speak English, no problem. Patient history take any history. Who take the history? The file. Who check the file? File. I think any one of you check the file. No, why? You check the file. The file of the patient. You. No one check the file. Okay. That patient today I will discuss about the ectopic pregnancy. It is a combined class, so if I confine to that case, no one can understand. So today they are lucky that yesterday they saw one case operated for ectopic pregnancy. There are the two, another and the evening also. Yes, there are the two cases. So incidence is slightly higher in our in this zone. So they are lucky. There are two cases. The evening, the more bleeding, I think so. Yeah. Yes. Where is the bleeding? Hemoperitoneum in the where? The hemoperitoneum abdominal cavity is full of blood. Okay, and the patient age is higher. They're about 37 years. No? The higher age is also there is increased incidence. Can you understand behind? They saw yesterday two cases, laparotomy for ectopic pregnancy. Okay, so it is important topics and common problem, and need immediate resuscitation with management. So what is ectopic pregnancy? Outside. Ectopic outside from normal, from anything behind normal. So ectopic pregnancy means when fertilized ovum implanted outside the uterine cavity. Uterine cavity is the normal place. So when implanted, developed in the outside the uterine cavity, then it is called ectopic pregnancy. So now we saw in the picture that is just clearly. This place is normal for pregnancy. Uterine cavity is the Thank you. It is the normal place for the implantation, normal pregnancy. When it is outside, so outside, this is, what is this? fallopian tube, and this place is broad ligament. This place is broad ligament, okay, and broad ligament, and this is what is the cervix, right? So these are and outside abdominal cavity. So what are the sites of the ectopic pregnancy? Oh, thank you. What do you think? What is the commonest possibly? Oh yes, fallopian tube. As first fertilization occurs in the fallopian tube. So in USA, incidence is 2 to 3%, and 3 to 4% in our overall surrounding the world. That is 2 to 3%. If there is 100 pregnancy, their incidence about 2 to 3. But in this zone more, ever more. I feel that there is more. So why ectopic pregnancy? Nischay there is some causes. And causes তুমি যদি normally চিন্তা করো, if you think that a fertilized ovum normally is in the fallopian tube, so of course the function of the anatomical physiological function of the fallopian tube is some problem, and also there is pathological change in the fallopian tube. Yes. So there is normally fertilized ovum migrates about 3 to 4 days to the uterine cavity, and it is implanted here. And so you can imagine if the fallopian tube is long, so it takes long time, and by this time there is so many changes, residual reaction and other pregnancy changes, total body adaptation or maternal adaptation, that is all the body, internal, external, all the organs were changed. So by this time there is hypertrophy, increased vascularity, and some residual reaction started. So she cannot pass through the narrow opening, and it impacted somewhere. Okay, somewhere means if anyone do not follow my class, you can ask anyone, hand raise. Okay, so fallopian tube. What are the region of the fallopian tube? What are the site of the fallopian tube? This is fimbriated end, then ampulla, isthmus, interstitial region. What do you think? Which region is vulnerable? Ampulla. So in the ampulla there is naturally 98% ectopic is in the fallopian tube. Others remaining are in the ovarian and other side. Okay. So in the ampulla it is why it is large space and more reaction occurs, and it is the fertilized site. So this site is more common. Okay. And now what I need to say, that is causes. Causes. So it is the long and abnormality. Other, if you think others, that is functional. Functional means in the fallopian tube naturally any movement in the fallopian tube. Yes, there is a movement, ciliated movement. Naturally there is movement in the fallopian tube, otherwise it cannot migrate towards the uterine cavity. So of course there is movement, smooth muscle movement, spasm. There is in the fallopian tube. What are the structure? Can you remember anyone? Mucosa, then submucosa. Any submucosa? Muscularis and outside. So there is changes in all over the structures. And there is if you think that any pathological change in the fallopian tube, if there is infection, what I say infection? Salpingitis. Put there, follow korte partecho? Can you follow me? Acha. If there is infection in the fallopian tube, it is called salpingitis. If there is infection, physiological function, it become normal or abnormal? Abnormal. So there is problem in the movement. And increased movement, that is you heard the name intrauterine contraceptive device, IUCD. If in where it is put, IUCD cavity here in this region, okay. This IOCD is T-shaped. You know that one, I think. All of you know. So, if there is IOCD, it is associated with increased motility of the fallopian tube. Okay? Even those are smoker which contain in the smoking which nicotine. Nicotine also causes the increased movement of the fallopian tube. So, there is increased movement, and increased movement hamper the normal movement of the fertilized ovum. It is goes outside and then implanted and growth development in any other side of the fallopian tube or within the fallopian tube. So, the common infection is known as pelvic, very good, pelvic inflammatory disease. So, pelvic inflammatory disease, I think all of you heard the name, so common in our country, so many different causes. So, pelvic inflammatory disease is associated with ectopic pregnancy, tubal ectopic pregnancy. Okay? So, I think pelvic inflammatory disease, then number 2 smoking, number 3 IOCD, number 4 any surgical intervention in the fallopian tubes. Surgical intervention, suppose reconstruction of the fallopian tube or salpingostomy or any tubal surgery, and then assisted reproductive technology, you know what the name, IVF, ART, assisted reproductive technology. If there is intervention of the ovum, the manipulation of the ovum spermatozoa and then implanted in the internal cavity. So, it is also associated with the ectopic pregnancy. Okay? এখন আসো তুমি যে what are the sign symptoms? So, it is an abnormal pregnancy, extrauterine pregnancy. So, sign symptoms তুমি এখন জানলা কারণ এখন তোমাকে একটা পেশেন্ট তোমার কাছে কিভাবে how the patient came to you, you should know. That is called sign symptoms or clinical feature. So, it is a pregnancy, right? So, there is sign symptom of pregnancy, but not so significant. Sometimes, most of the time asymptomatic most of the time. Means there is no symptom. Suddenly patient came to us, there is severe pain, shock, faint, and then there is sometimes bleeding. So, three symptom is important. Commonly 3 symptom. Number 1, right, amenorrhea. There may be even so short period amenorrhea, maybe 5 days or 7 days left, and there is pain, lower abdominal pain, very good, lower abdominal pain, and then pervaginal bleeding, scattered spotted bleeding. So, these 3 are so important, but there may be no symptom. Okay? So, what I say from last bench, what I say? Anyone stand please? Anyone stand please? Oh, good, thank you. What I say? Amenorrhea, what are the symptoms? Yes? And pervaginal bleeding, very good. Okay, thank you. So,